I was called by Dr. Girton and his colleagues in the ICU. Trevor had been admitted.
When he came to us, he had developed an infection of his lungs. He was having some trouble swallowing already.
I was told that he had a type of a glycogen storage disease that was unknown, that was affecting his muscles.
It was undiagnosed for a couple years after that, and he kept getting pneumonias.
Trevor was extremely weak. He had lost any ability to support his own body weight, and he was also having trouble keeping his lungs open.
They intubated him, and he had us come in the room to keep him calm because he probably wouldn't make it if they gave him anesthesia on top of him going through respiratory failure.
We were able, by using pressure and oxygen applied to his airway without putting him on life support, to get him through that first episode of pneumonia.
We tried BiPAP without tracheing him, and he went through a couple surgeries, and Dr. Gert said, "You're going to end up having to trach him," and we did.
We also did a biopsy of his muscle, and we finally got general agreement that what he had was a disease called Pompei's disease.
Trevor has enzyme in his muscles, it's called acid maltase, and he's deficient of it. And what happens is the glycogen in your body, this enzyme breaks it down into glucose. Well, he doesn't have that. So the glucose is sticky and it stays in the muscle tissue.
We knew that we had a drug available that was FDA approved to treat Pompe disease.
It's not without risk. And so we agreed that he would come here for his infusions.
We've been doing infusions for about 1.5 years now at Sparrow. Every other week we go. This is our first Pompe patient that they've had infusion therapy for at the hospital. Do you want to play with your truck?
For his birthday, we bought him a remote control truck, and he very much enjoys smashing it into everything.
Go on the gas and do a pep wheel.
Since that time, his personality has blossomed, his willfulness has become obvious. His ability to interact and develop, and not just express himself, but share in the life of his family, has been augmented tremendously.
Our family built him a swing. We put his vent and everything on it.
Do you want a super dog? All right. You sure? Aren't you scared?
We've come to enjoy the whole family. They're so responsible and they care so much, and they will do anything for him. And that included going at risk for this new therapy. They did it, and he's benefited from it to their credit, and to the credit actually of this community and the people we have in it.
Enzyme replacement therapy at many institutions is a challenge because first you want to make sure that you have all of the setup just to do a regular infusion therapy. The second issue is unfortunately a financial issue. These drugs are very expensive. They cost tens of thousands of dollars, or sometimes even more than that, over the course of a year. And there needs to be a commitment on the level of the institution that they will support that intervention.
Trevor has become the poster child for this treatment, but more importantly, seeing what happens with Trevor as he gets this treatment is a way of anticipating what will happen to more children as more and more children have access to the treatment.
We knew we were going to go all the way with him and get through it, and we did, and he's doing great.